Hey everyone, it's Naomi Wolf here, and I'm thrilled and honored to be re-welcoming one of our superstars in the Five Freedoms fight. We're nonpartisan, but I think it's fair to say, that those who support the Five Freedoms campaign absolutely are thrilled to have Senator Kim Thatcher as a champion. Senator Thatcher is a state legislator from the state of Oregon. She's a Republican, she's a businesswoman, a mother, a grandmother, and she represents District 13. Welcome back, Senator Thatcher.
Thank you. It is always a privilege to have a conversation with you. I just feel awestruck having a conversation with you, so thank you so much.
Well, it is a mutual admiration society, so having shared that, please go right into what's been happening. You've been thick in the fight. Last time we checked in with you, you were advocating for medical freedom, advocating against vaccine passports in the state of Oregon. I just want to remind people that when I posted Senator Thatcher's press release verbatim about a bill she'd introduced to ban vaccine passports, Twitter deplatformed me permanently. So you're right over the target, whatever that target is, Senator Thatcher. And I'm thrilled to be able to talk to you. I hope things don't explode because of whatever you say next. But
right. Now, I will tell you, my inbox says another completely different story. People are so concerned about the vaccine mandates that are coming out. Basically, the vaccine passports we're all worried about. That's essentially where we're going. And they'll send back and they'll respond back with, but I'm getting kicked out of my online school because I don't have a vaccine. Online school.
Online.
So that tells you this is not about health and safety of others. And they're online in their home, not even stepping foot on campus, losing their scholarships, losing the time they put in to just part way into a semester. I wonder, I feel like I'm in a twilight zone sometimes.
What are you at liberty to say what universities or programs these are?
I think it was PSU, actually. I think it was PSU, but all of our
so that's a state university.
Yes, and for many months now, our universities have said that, hey, come fall, if you want to step foot on campus, you have to have had your vaccine, or be fully vaccinated, whatever the term seems to be. But now, I mean, that's going to a whole new level, saying, well, you can't even attend online school. It's not stepping foot on campus. It's just
extraordinary. And let me just ask, because every state is different. In the state of Oregon, because many millions of students have gotten these kinds of notices, parents are distraught. In the state of Oregon, are there not religious or philosophical exemptions or medical exemptions that you can apply for to not have a vaccine?
That's the other trick. Yes, there are supposed to be. EEOC says so. Our federal civil rights law says so. There are a number of places, I can't even, it's just so much happening, as you know. It's hard to keep track of it all. But there are some places saying, well, we'll give you the form. You fill out our form. Well, come to find out, in the state of Oregon, the state employees are asked to get onto their online, work platform and use the form the state uses, and they use the word exception and not exemption.
No, to trick people. You're kidding me.
Not kidding.
And then it's not a formal application for an EOC protected exemption. And so the organization can say, sorry, we turned down your request for an exception. So in case people are confused by why we're freaking out about this nerdy distinction, it's because if you don't use the language in the law, you're not protected by the law. That's the issue, right?
Exactly.
So sneaky. So basically, if they want to revoke it, they can. If they want to, not give an exception to the next person, they have that choice because they've done an evil workaround of our actual law. That's so awful. And I just want to jump in before you go on to tell people, because we've got a national and a global audience, that Governor Brown is Democrat, and she has issued one draconian measure after another. She reinstituted mask mandates. It's just it's just one coercive measure after another, more extreme than any other state except Southern California, which is its own almost state, and where I'm sitting right now, which is New York. Is that a fair thing to say?
Yeah, and you don't hear about it. You'll hear about New York, you'll hear about California, and of course, they'll make up things about rates of this or that in Texas and Florida. But Oregon, yes, she reinstated the mask mandate for indoors and outdoors. So
Madness.
there we are. And all the school children have to sit in their classroom. I guess if we gave them all snacks, they could take off their, I don't know. It just doesn't make sense. None of it makes sense.
The little kids can't take their
lineup. Yes.
They can't take their masks off outside at recess. Those poor little bunnies have to wear their masks outside.
Yes, exactly. We have an indoor and outdoor mask mandate unless you're in your home or your car. And I don't,
unless you're in your home or your car, everywhere in the great outdoors of the beautiful state of Oregon, you have to wear your mask outside. Are you telling me that?
Well, that's what is called for in most outdoor places, especially if there is not the ability to physically distance. And I see people walking down the street all by themselves, riding their bike all by themselves, nobody around them, and they have their masks on, and I just don't get it.
Well, it's an edict, right? I mean, Governor Brown declared it. Is she fining people who don't comply, or is she fining businesses who resist? I know you've had some resistors in Oregon who are not going along with this.
Right. There's so much happening. I just can't imagine that she would give up or back off on the what she had been doing before, when the mask mandates were in place, that before they were lifted and then put in again. It's just,
did she offer any science to you as a state legislator?
No.
And have people been asking for the science? Because studies do not support masking outdoors. People have asked for the science. What happens?
They just say, well, it's something that's recommended by CDC, or they'll say, they'll just backpedal and just kind of put it on some other agency. Well, this is what they're saying. And so therefore, we're going to do this thing, even though there's no evidence, there's no studies, or no published peer-reviewed actual scientific studies that support mask wearing, especially in little children.
Oh God. So, and you as a state legislator and other state legislators, are any of you bringing up the studies that now are emerging that show damage to kids cognitively from mask wearing in school? And distance.
Absolutely, it does no good, because this really is not about science. It is not about public safety or public health. It is all about coercion through fear, and compliance through the use of fear-mongering and fakery.
So what do you think the end game is? Like, it doesn't really make sense in terms of normal politics. People aren't going to love the party that's doing this to their kids. So as a politician, put on your politics hat now. You're not your governing, but your campaigning hat. Why are they doing this in your view? What's the reason? Who's behind it? And is there any money that you're aware of that's flowing toward these policies?
Well, Big Pharma, they own the networks, they own the media. Basically, they're the biggest sponsors. You just turn on a daytime television show, every other ad is pharma. So they are big supporters, so they can control the message. You look at social media, you look at, anywhere where you see people getting canceled, shut down, like you on Twitter, it's because it's pharma. A lot of it is big pharma. And
so why aren't Republicans also coerced by pharma? Your team seems to be the group right now, and I hate to say this as a Democrat, but I have to be honest, that's standing up against these extreme measures. Why isn't pharma just plucking you guys off one by one, the way they seem to be plucking off our team, or my team, I should say?
It's hard to say that they're not doing that. I don't know. It's just, I have not seen that to be the case, but it does make it so that when people, or even Republicans who need money for their campaigns, want to speak out, they have to think twice. They have to soft pedal it a little bit in order to not be too harsh, to not, to prevent that check from coming to them to help them get elected. It's
understandable.
It's definitely
it's definitely real. All right. Well, let me ask you then, what is the game plan that you observe for the midterms, because I don't see how this can be a winning strategy for the midterms. People are angry, they're upset. It's walkout week across the country. I don't know if word of that has reached Oregon. Maybe it originated in Oregon, but people are walking off their jobs. They're keeping their kids out of school in protest for these overreaching medical mandates. How, from what you hear from your Democratic peers or gossip or rumor or the buzz, how are they figuring that this will play well in reelecting Biden-Harris, or in even keeping control of the national government in the midterms?
Well, there's a couple schools of thought there. One is they're all about health and safety and protecting. So therefore, and that's the message that gets repeated on the mouthpiece of the media and the social media. So that's the big message everybody's hearing. And the fear that people that are just, normal moms and dads and grandmothers are out there just going, oh my gosh, I got to comply. Oh my God, this is just, because it's so, you would think that there was a 50% death rate on this, but any death that's premature is sad, of course, but it's so over dramatized that the messages are just getting out to the masses in such a way. Hopefully they'll start to wake up and try to do some research on their own and realize this just is not adding up. What they're saying is not adding up. But then again, you also have the fact, and this is my opinion, that elections can be manipulated, and I think they were. And I think there's going to be stuff coming out about that. However, and that's got to be changed, because if they're going to be manipulated like that, it won't matter. It won't matter what they do, because they can just manipulate the elections. So that's the other issue.
Well, those are strong words, and we'll, wait and see. I mean, whatever side of the aisle you find yourself on, I always feel like there should be no fear in auditing. If you haven't done anything wrong, you shouldn't fear an audit. I said that in 2000 when they wouldn't, let us count the votes. And it's always a good idea to count the votes, no matter what side you're on.
And the process, not just the vote, process, how they got there. And
examine the process. Exactly right. Exactly right. So since we don't know the answer to that yet, there's no definitive news. Let's move back to the state of Oregon. You're in a very important role, because you actually have access to the actual death rate compared to other causes of death in Oregon. I don't mean to put you on the spot, but as you and I may have mentioned, when I last went to visit my mom in Corvallis, I was shocked to map the actual table of causes of death in Oregon against the news. And the news was in a hysterical kind of furor that was terrifying my mother. But when I actually mapped the causes of death, it seemed like the average age of death was the same as the death age average for any human being in the United States. And also that in Oregon, COVID, even, if you assume that every death marked as COVID really was caused by COVID, it was number 9, and that was below opioid overdoses and suicide. And when I told my mom that, she really relaxed, because it put the risk into perspective for her. I mean, even though she is in the elderly age category, knowing that it's so far down on the things that you need to worry about really supported her kind of mental health and well-being. So tell me, do you have access to what the actual death rates are? I also want to ask you about the Delta variant, because it seems like everyone's on a message of this is so infectious. And I don't mean to belittle anything, but is it actually translating into more hospitalizations, more deaths from COVID in the state of Oregon? Or do you have any information about that?
Well, I do have access to death rates. I have not looked at them lately, but I did notice in 2020, whenever that data came out, that COVID essentially cured the flu. We had no flu death rate. I mean, it was very, very low, if any. And it was pretty crazy. Yeah. And then nationwide, you look
Right.
and you compare that with previous years of 65,000, 45,000, however many deaths from flu, and then it goes down to like 1,200 or something. It's kind of crazy. But I have not looked at that lately. And I believe that is why they want to change the PCR test to use a different test to be able to differentiate between the flu and COVID. That's what I'm hearing anyway. At least
Well, that would be good, right? Wouldn't that be good? Who's
you would
they?
think, yes.
So is this coming from the people, or is it coming from the top? Because the
Oh, that's the
PCR,
CDC. That's the CDC saying we're going
CDC
to.
wants to change the PCR testing so that it can differentiate between flu and COVID. Is that correct?
Well, or change the testing to a different method, since
Right.
PCR was not meant to diagnose the presence of a disease.
That's a huge concession. I
Mhm.
was not aware of that. That is a huge concession from the CDC of something that reporters like me keeping deplatformed for reporting, which is that the PCR tests can be run at high cycle thresholds, which is more likely to guarantee a false
Mhm.
positive or low cycle threshold.
And they have two different standards. If you've had COVID, or if you've been vaccinated, they make sure they run it at the low cycle threshold.
No.
Yeah. I can't remember what the number is, but they allow the higher threshold for others. So one will get inflated over the other. That's why they can talk about the higher number unvaccinated versus vaccinated in the hospital.
That's a good question, because when you take a COVID test, I wasn't aware that they even ask your vaccination status. They do now.
Well, it might be in the hospital. This might have to do with
I see what you mean.
specifically, because they're talking about hospitalization rates of vaccinated versus unvaccinated. So if you go into the hospital for a broken leg and you also get a PCR test that tests you because you haven't been vaccinated and it shows you might have COVID, which we know those tests can create a high number of false positives.
Yes.
Then they'll talk about this person being vaccinated, unvaccinated, taken over bed, even though they're there for a completely different reason. But the thing is, they will differentiate between vaccinated and unvaccinated, and they recommend a lower, in the CDC guidelines, a lower cycle threshold for those who have been vaccinated versus the unvaccinated. Plus, you have reports of more vaccinated or unvaccinated people taking up beds, and that's creating a lot of fear and stress in people. People who are cancer patients who can't get vaccinated, or people who are in a position they're getting feared.
Can I jump in and ask?
Yeah.
Let me ask a question about that. You're answering something I've been wondering about. I've noticed that the wording often is people in hospitals are unvaccinated, or the hospitals are filled with the unvaccinated, or they'll say so many thousand deaths, but they don't say hospitals are filled with the unvaccinated who are sick with COVID, or there are this many thousand deaths from COVID. Is that what you're telling me, that people are being counted as filling the hospitals, even though they're there with something completely different, if they've been given a COVID test and it's been run at a high cycle threshold rate?
That's what I'm hearing. And it makes sense when you look at what is being reported to the media as number of beds available versus what's reported to the CDC. That's supposed to be accurate information going to the CDC. And the fact is, the number of beds in Oregon, I can't remember the percentage, but they've been steadily going down. The number of beds available is going down. So, that's something completely different than vaccinated versus unvaccinated. That is a hospital administration issue.
Right. Let me understand. The number of beds available, period, in the state of Oregon is going down.
Yes.
That doesn't necessarily mean that. It sounds like funny math. It doesn't necessarily mean that the number of people occupying the beds is going up. Is that what you're telling me? The overall number of beds available has gone down. So that can be done by just removing beds or spacing them because of social distancing, right?
Right, or reducing their staff. You look at how many healthcare workers have lost their jobs over the past year and a half.
Right.
It's quite high.
So basically, you're being told as a state legislator And certainly Governor Brown is issuing press releases, and the press is picking up that hospitals are running out of capacity, right? And the implication is because of COVID. But what you're saying is that's not verifiable. It's not verified. What is verified is simply that staffing is going down. Maybe hospital administrators are reducing the number of beds, but there's no evidence being given to you that the number of people with COVID filling the hospitals is going up and causing this running out of space. Am I understanding you correctly?
The number of beds available have gone down.
Right.
And so therefore the percentage of beds taken up looks
high.
More
but I guess what I'm asking you is, there are two ways to interpret that, right? If you aren't asking follow-up questions and you're the victim of bad reporting, which I've seen again and again in, sorry, gotta say it, the Oregonian. Yeah, I named it, I said it, you don't have to say it, I said it. My mom reads it every day. I honestly, I wanna challenge them to something, because I can't bear the fear mongering. But if you read the Oregonian or Governor Brown's press releases, it'll say something like, hospital capacity is running out, 20% spike in COVID infections. But that could actually mean that hospital administrators have lowered the capacity, have removed beds, have closed off beds, don't have enough staff to care for beds, are even saying there are only this many available because we only have this many people to look after the people. However, it doesn't necessarily mean at all that the hospitals are filling up with sick and dying unvaccinated COVID patients. Is that correct?
Correct.
Wow, that is
just
evil.
Very misleading, very deceptive. And what gets reported is, I mean, the media, the mainstream media is the governor's mouthpiece. So
wow.
Eat whatever. And
do you know, are your constituents, do you have a lot of very sick with COVID constituents?
Not that have contacted me. I have to say that the one time I had to be put into what I call solitary confinement, quarantine, whatever, I was healthy, just fine, but I had been exposed to a vaccinated person who had acquired COVID. So I had to go into quarantine.
I bet they quarantined you.
This vaccinated person went into ICU. She was in intensive care.
Sorry to hear that. Wow. Yeah, well, let me ask it in a broader way. You are in close touch with, hundreds or thousands of constituents in your community. What are the top health issues they are dealing with that they share with you?
I think that, what people share with me, they are concerned about contracting. They're actually concerned about having to go to the hospital. They don't want to go to the hospital because they know they would not get the treatment that would be most beneficial to them, or at least they are fearful because of I might be saying it, remdesivir and ventilators is proving to be a combination that can not give good outcomes. And
so they're scared of being treated in a way in the hospital that they will die or get hurt, right?
Right. So there's that concern. So they want to be able to do preventative measures. They don't know what those are, or they pass them along to me saying, "Hey, here's a protocol I've heard about. You might want to look into it." There's just so much happening around it.
People fear, and I've heard this from Canada and from places around the country, people with other health conditions like cancer and heart disease, people who really should be going in to get checked in the hospital, are scared to go in because they're scared they'll be found to have COVID and put on a ventilator, kept from their family. Is that what you're saying? Or they're just not getting the care they need?
Yes. The fact that people are not able, in fact, during the beginning, the flattening of the curve time, the 14 days, and beyond that, when they seem to double down with some of the extreme policies, lockdowns and all that, people were not getting the health care they needed because they didn't have access. Or the other problem was they were just scared. They were scared to death of catching COVID because of the fear mongering. And then the other thing is now people are afraid of the treatment they might get if they actually ended up in a hospital with COVID. So
I have to validate and say I'm hearing those stories that people are going in with stroke or going in with heart attack, and their loved ones never see them again because they're found to have COVID, and then you're not allowed to go in to be with your loved one. So that's what your constituents, those are the kinds of fears your constituents are expressing. What do your constituents want you to do in relation to vaccine passports, masks in schools? What are you hearing from them?
Constantly hearing, why don't you stop her? Stop the governor from doing these things. Stop the OHA, stop this. But of course, I'm part of a legislative body, and it requires a majority in order to act as the body. So there's no personally stopping anybody, unfortunately, but I can try to get the information out and try to relieve people's fears. I had a cancer patient write to me just the other day saying, what are you doing to support these measures and higher vaccination rates? Because I don't want to get COVID. But she's been told a lot of, I think, falsehoods or deceptive statements that which leads her to believe that. So it's wearying.
I'm so sorry. And tell me, is the State House open in Oregon now? Can people go in and legislate?
It opened right after the main session was over. Now, will it be open for the legislative session next week? That's a good question. I have not heard one way or another on whether the public would be allowed in or not. I am betting not, but I don't know. We'll see.
So how long has it been since the people of Oregon could walk into their state house and listen to deliberations live?
To listen to deliberations. They could walk in their capital now. They could walk into them right after the legislative session was out. So it would have been February of 2020. So they
can't watch you deliberate live. Can they show up in person and testify to the legislature?
Not in person. Everything is online. In fact, this latest bout of redistricting, trying to figure out maps, they came up with information that everybody was supposed to digest over the Labor Day weekend and be ready to testify starting Tuesday morning after Labor Day.
Wow.
And then they're wrapped up all their testimony by last night at 8 o'clock. So it's been very rushed. It seems purposeful. It seems a great way to just kind of, do the perfunctory, public testimony thing. Just, get on with it, what you want to do anyway. That's the way it seems to be.
So basically, if I'm hearing you correctly, there's nothing guaranteed right now to the people of Oregon that they can in person go into their state house, watch live deliberations, and testify in person the way the state of Oregon is supposed to operate with its legislature, right? It's still indefinitely on Zoom, still indefinitely on an electronic platform. Is that correct?
As far as I know.
So Senator Thatcher, a lot of different state legislators across the country are being really creative with how to address what is becoming visible as, I don't want to say a fraud on the American people, but certainly policies that appear to be based on distorted data, distorted reporting. What kinds of things have you heard about that legislators are doing creatively?
Well, there are Freedom of Information Act requests. In fact, Senator Dennis Linthicum submitted a request to the Oregon Health Authority inquiring about the cycle thresholds they've been using for PCR tests and various questions about that. They refused. They refused to get back to him. He's on the healthcare committee, has been for a number of years, and they refused. They just basically said, no, it's private information. So they're hiding behind this veil of, oh, we don't have to tell you. And no information, none.
But I'm shocked to hear that. I'm hearing this kind of, it's private to protect all the discovery of this misuse of data. I just want to say, as a data CEO, it's super easy to block the name and any personally identifying details and still allow legislators to review this data. So I'm pretty shocked about that. We'd love to publish their correspondence to him if he's willing. Is there anything else that legislators are doing that you'd like to let me know about?
Well, sure. Stay tuned. There will be a petition, or has been a petition, for a grand jury investigation into some of the actions of our federal agencies. We'll see what happens from there. I can go into that later.
I can't wait to circle back to you about that when that's in the news. And lastly, on a happier note, you are such a so connected to your constituency, and I'm sure many people think such a role model as a legislator. Tell us if there's any legislation you're especially excited about.
Well, one that I think has legs and actually could go through has to do with compensation for people who have been wrongfully convicted and imprisoned. You know, there are things that go wrong in our justice system, and when they do, and the wrong person has been put away, that person's life has been shattered, ripped apart, torn apart, and then they can just let them out and go, "Whoops, we got the wrong guy. You're free to go now." Well, now what? You got to pick up the pieces of your life. And so we're one of the very few states that do not have any such compensation programs. So that is something I'm working with a number of Democrats, and we're trying to perfect it so that we can get some of the more hesitant to come on board in the February session. I had this bill during the last long session, but it didn't quite make it over the finish line. So I'm going to reintroduce it.
What's the name of the bill?
Well, it doesn't have a number yet because we don't have those yet because of it's not till February, but it was Senate Bill 499 during the 2021 session. And there might be some different things happening to the bill, but that's essentially the same bill that I'll be introducing.
That is a beautiful bill. I love hearing what happens when people align from whatever political party to bring about justice and to look at how to make our justice system better.
That's wrong. You've had your liberty taken away, your life taken away. You need compensation. That's your personal property. I believe in compensation for taking of your personal property, and that's the ultimate taking of your personal property right there.
Senator Thatcher, you've been so generous with us as always. It's always so inspiring to talk to you. How can people help you if they like what they're hearing? How can Oregonians or your constituents or people nationwide help you do what you're doing? Where can they find you?
Well, I'm on kim@kimthatcher.com. That's my personal campaign email, but then I also have the legislative email, which is sen.kimthatcher@oregonlegislature.gov. So,
and are people allowed to contribute to you, or is that unlawful at this point?
No, they can, but it would be through the kim@kimthatcher.com account, and there's a donate button. So yeah, I'll use support. There's got to have that money to get the message out sometimes. So
wonderful. Okay, so everyone, if you want to support Senator Thatcher, you know where to go. Thank you so much, Senator Thatcher. Can't wait to hear the next update. Thank you for joining Daily Cloud today. Thank you.
My pleasure.
Bye-bye.